And while you're in that section, looking for the medication, do you do something?
I called Lindsay.
And why did you call Lindsay?
Because what we were looking for wasn't there. The shelves were pretty empty. It was still during COVID.
I'm sorry, what?
It was during COVID, so.
Okay, so, and was that call at about approximately 5:33 p.m.?
Yeah.
Okay. And then, did she answer the call?
Yes.
She answered when you called her?
Actually, I think she didn't at first. She called back.
Okay. And did you receive a call back from her about a minute later at 5:34 p.m.?
Yeah, that's correct.
Okay. And can you describe that phone call for us?
It was very brief. I just said, I think there's a generic brand, and I said, is this one okay? And she said, yeah, that's fine.
And what was her demeanor during the call?
She was pretty quiet. It sounded like she was busy. I remember hanging up thinking she's probably in the middle of giving baths or something like that.
So it sounded to you like she was in the middle of something?
Yeah.
Were you able to understand her when she spoke to you?
Yeah.
And did she seem to understand what you were saying?
Yes.
And she didn't seem to have any trouble recalling why you were at CVS or what you were looking for?
That's correct.
After you removed the band from Callan's neck, what did you do next?
I tried to find Dawson.
And where did you go?
I looked in the bathroom and on the other side of the couch, and then I went to the other side of the basement, and he was in my office.
And when you saw Dawson, what condition was he in?
I knew he was gone.
And did he also have a band around his neck?
Yeah.
And did you remove that band?
Yeah.
And looking at the office here, where was he located within the office?
Just to the left of the door when you went in.
Just in this area here, right inside the door?
Yeah.
The right dosage and that she was on the right medications, and then just ongoing evaluation in terms of kind of her mental status.
And during that meeting, she denied suicidal intent, correct?
That's correct.
She denied homicidal intent, correct? She denied having auditory or visual hallucinations, correct?
Yes.
She reported her mood as okay, is that correct?
Yes.
And she told you she was looking forward to moving to Spalding, correct?
Yes.
She also denied any confusion or disorientation, is that correct?
Yes.
And you described her as future-oriented on that day?
Yes.
And then you spoke to her again on February 21st, 2023, is that correct?
Yes.
And during that time, you wrote that the patient reported feeling down about her current situation, her paralysis, and the events leading up to her hospitalization, is that correct?
Yes.
Else she killed the kids. Dr. Dow, DAU, a psychiatrist retained by the Commonwealth, reviewed the defendant's medical records, prescription history, her journals, and didn't find anything out of the ordinary in the manner of treatment or in the medications that were prescribed to her by her providers. She testified at grand jury that the trial of different medications and different combinations and dosages is routine medical practice when initially treating a patient and trying to find out what works for them. The defendant wrote a note on her phone on October 25th, 2022, stating, "I think I sort of resent my other children because they prevent me from treating Cal like my first baby." She also wrote, "I want to feel love and connection with all of my kids. This would indicate that she did not feel love or connection with at least some of her kids. She then wrote she wants to have more kids eventually. 4 days prior to killing her children, the defendant did an internet search on her phone, and it was, quote, "Can you treat a sociopath?" The children were killed with ligature strangulation. Ligature strangulation causes the victim to become unconscious anywhere from 10 seconds to a minute, and that depends on how much the victim struggles or fights. The more they struggle or fight, the longer it takes. Dawson had the most petechiae on his face and neck. According to the medical examiner, this means Dawson either struggled or fought for his life more than Cora or Callan were able to, or that she strangled him harder than the other two, or both. And it takes 10 pounds of pressure at minimum to strangle. She could have stopped at any time. She could have changed her mind at any time. She could have helped them at any time. She did not. Instead, she finished strangling the children, returned her husband's phone call, then went up to the bedroom on the second floor. There she used the knife to inflict superficial cuts and scratches to her wrist and neck. She took the remaining pills of the Remeron and Seroquel, and then she climbed out of the bedroom window and gripped the windowsill while dangling from it. We know this because there's blood on the outside of the windowsill where her wrist would be in her hand. She then dropped from the window or slid down. She did not jump. She did not hurl herself out the window because there's blood on the exterior shingle going down the exterior of the house. And then on the window, directly below the window she came out of, there's more blood on the top level, looking like she tried to grab onto that windowsill. While being treated at Brigham and Women's Hospital in Boston after killing her children, the defendant spoke to medical staff. On February 6th, she said that she had fears that her inability to walk would make her vulnerable to others, and that she was worried about not being able to walk again. On February 7th, she said she was feeling more hopeful about her future. On February 8th, she stated that she was more future-oriented and hopeful. And on February 9th, she was visibly engaged, energized, and hopeful.